Mr. Barrow,
Hey, buddy.
what's going on?
Good to see you.
You too. It's been a
How are
while.
things? It is.
Good man,
Love the
good.
beard.
What's that?
I love the beard.
Ah, thank you. Looking good
It's
yourself?
coming in thick.
Oh yeah. I actually shaved a lot of this off. Like I went full like wildebeest for a while.
You're kidding. I'm actually not surprised.
Oh yeah.
Your old man always grew a nice thick beard.
Oh yeah. My old man, both my brothers, like everyone.
Oh yeah. Oh yeah, that's right. Your older brother Dave always had a good one, didn't he?
Oh yeah. You used at a coffee shop or your place?
I'm at my place in the backyard.
Oh nice.
Hey man, I should give you a little tour actually. This is our like courtyard. Another
Dude,
kind of
this is
garden.
so cool.
Yeah, we got really fortunate. This is actually kind of cool. I got this from a random guy at one of the hospitals I was working at. It's called a kombucha or something. It's like this Japanese squash.
Unreal.
And then we got like some peppers or whatever in there. And this is like a monarch butterfly plant that attracts all these monarch butterflies.
Yeah.
This is Charlie. It's our
Hello,
pupper.
Charlie.
Pretty good. Who did? Got stuff all over you.
So it's kind of like communal living, eh?
Yeah, pretty much.
Are you guys having fires right now?
I haven't heard of any big ones yet. It tends to be later in the summer, like August and September, when they get bad, just because it's been dry all summer and then it just takes off. But they do a lot of controlled burns. So if we go try, like for example, we went to, actually I don't know if this was a controlled burn, but we went to Paso Robles, which is like I was telling you we went up the coast.
Yeah.
It was like 3.5 hours north of here. It's kind of like wine country. It's kind of like Napa, but not as popular, not as big, not as expensive, which is nice, and still just as beautiful. And we were driving through, and we could smell or see a bunch of fires. I don't know if they were controlled or not. But sometimes they just try to burn the brush to prevent them from getting out of control.
Yeah.
Yeah. I
Dude,
think there was one in National Sandwich Stores.
That shit's terrifying.
Yeah, it's bad.
BC was the first time I saw that. Like, I just saw the fire, and I was like, we driving into the fire? Like,
yeah.
We sure we're good here?
Yeah. It's just like super smoky. Another time we were driving home from a camping trip, and it was kind of this valley area. You kind of drove down, and it's just flat, almost like the plains. And there was like little pockets of fire next to the freeway, and there's all this smoke and like tumbleweeds going by that are caught on fires. It's
Jesus
apocalypse.
Christ.
Yeah.
That's like ancient warfare. Them setting those fireballs.
Yeah, exactly.
My God.
It's like Troy, buddy.
Yeah. So were you guys doing like wine tasting and stuff?
Yeah, so we went with another couple. They really enjoyed this in a town called Cambria, which is right on the water. It's this beautiful little kind of coastal town. So we just stayed there, and then it was only a half an hour drive into the wine country. So we were like, we might as well take advantage of that. So we just did it for a day, and yeah, it was unreal.
Dude, I love that. Like just walking around, tasting different wines, being in nature.
Yeah, man. Have you been to Los Angeles before? Or like California? Southern California?
Not California, but I've been to LA. Am I saying that correctly?
You've been to Los Angeles. Oh, that's right. You were playing poker down here, right?
Yeah.
Yeah, that's right.
Commerce Casino. It was like near the ghetto, I think.
Yeah. Gotcha. Yeah, definitely.
Yeah.
So Los Angeles, it would be in Southern California. But so you were just playing probably in this tournament, and you didn't get to explore too much.
I walked around. We went to like a Clippers game.
Oh, nice.
So we went to like that center there, but other than that, pretty much in the casino most days.
Gotcha.
Yeah.
Yeah, nice. I was just saying because you would love it, man. Just so beautiful.
I bet.
Some days I feel like I'm in the jungle.
That's awesome. Yeah. So where's like the hospital that you work at in like comparison?
So it's a 15-minute drive south of me.
15-minute drive.
Yeah. So I'm kind of northeast Los Angeles, in a like a city called Highland Park. then the hospital is kind of more towards downtown. So I'm like 20 minutes from downtown, and the hospital's like 15 minutes or like 5-10 minutes north of downtown.
Okay.
Yeah.
And it's like one of the biggest hospitals in the States?
The hospital itself, I don't think it doesn't carry that many beds per se, but the emergency department sees some of the most people in the States compared to how do I say this? Like I think it's between 150 to 175,000 visits a year or something like that. That's just like people that come through the emergency department. So we're one of the busiest EDs for sure.
I remember you kind of like, is that one of the reasons why you want to go there, like for experience kind of thing?
Yeah, exactly. I'm not. It's funny because I've been here for so long that I kind of forget what it was like at home in our emergency department. But I imagine the medicine's relatively similar anywhere you go. I mean, you're going to have certain diseases that are more prevalent depending on the population or demographic that you see. Like, for example, we see a lot of Hispanic patients here, so that's going to be different than home, obviously, just because there's differences there genetically. But the volume, right? I mean, we're going to see way more stuff coming through the ED, especially trauma.
Yeah.
A lot of penetrating stab wounds, gunshot wounds that we're just not going to see at home, especially in Halifax. So all that. It's experience.
Yeah. I mean, unfortunately, Nova Scotia just had the world or Canadian's largest gun shooting ever. Sure.
That's right.
Nova Scotia's gotten kind of weird, like.
Yeah. I say that. I guess it's kind of sadly ironic, but that was crazy, man. I think I woke up. I was staying down in Long Beach at the time, and I woke up to Cody saying that he just got the SWAT team just like blew into his house to say that his neighbors were targeted by the shooter and they needed to either lock themselves in their basement with guns or
leave. Oh my gosh. What?
like what do you mean, man?
Jesus Christ.
That's scary times.
That was scary. And just strange, like, because I mean, you see, like you said, like these things probably every day, like gunshots and stab wounds. But Nova Scotia, that's very unusual for us.
It's very unusual. And also just the story surrounding it. I mean, we see a lot of, it's mostly gang violence, right? Which is kind of, it's that what's expected, right? It's usually just gang members shooting or stabbing other gang members. This one was close to home, and it was kind of a just sad and sick person.
Yeah, like premeditated, which is the
exactly
strangest thing.
Yeah, and all the innocent lives, that's what really.
Yeah. Hurts when you hear about shit like that.
Yeah, for sure.
Actually, very similar-ish. Just the way I felt with the George Floyd thing, just like watching that video ruined like my entire day. Like I couldn't.
I hear you in the same way.
Disturbing, eh?
Yeah, it's sad. Yeah, I mean, it's interesting because at the hospital, like obviously we see sad stuff all the time. Sometimes people get kidnapped or like their significant others, like domestic violence will hold them for a couple of days and beat them and rape them and things like that. It's sad to hear, and then you see them come in and you kind of just you're almost like in the zone. You just take care of them, right? It's kind of it's a way to compartmentalize so that you don't feel bad about it. That like visceral bad reaction that makes you sick to your stomach. You try to like avoid that. But then when you see these things that are far away, like this thing at home or the George Floyd thing, it almost feels worse because you're like witnessing it. It's like, man, that feeling it's crazy.
Yeah, I can't even imagine how it feels like when that stuff's going on. Like, I assume like your adrenaline's like pumping.
Yeah, I mean, honestly, it kind of depends on how sick the patient is and how quickly they come in. That changes my level of excitement or adrenaline, because that kind of changes how fast we need to do things to save their life. sometimes there's really sad stories where the patient is relatively stable, so there's not so much that I need to do quickly to kind of stabilize them, but what happened to them was awful. So it's more that just I kind of separate those two emotions or feelings. But yeah.
So just to clarify, like, it is the
Yeah.
emerge that you're working at?
Yeah, I'm in the emergency department.
And like, what would you say is like the most common thing you see people for?
The most common, I mean, so our emergency department is so big that we have all these different areas depending on what your complaint is. So what I've just been describing to you is what our resuscitation bay is, which is this like 12-bed trauma bay, which is where you see all these gunshot wounds, all these patients that come in really sick by ambulance, motor vehicle crashes, motorcycle crashes. They all come into the resuscitation bay. That's kind of the sickest of the sick come to this area. So on any day you could see, I mean, it just, who knows, see burn victims, drowning victims, whatever it is. Now, if you are in the medical bay, the big medical bay, this is probably the most common stuff we see. It's your run-of-the-mill chest pain, belly pain, things like that you get worked on medically for. And then there's the fast track area where you see, broken wrist, something in my eye, back pain, that kind of stuff. So all this stuff gets triaged from when they walk into the hospital. They'll take some quick vital signs, get a quick story, and then they'll route them to the appropriate area. So as residents, or now as a fellow, you're in one of these dedicated areas. So any day, what you see that day is going to depend on where you're working in the emergency department. I don't know if that was clear or not, but yeah.
So you might be in different areas on different days?
Exactly. So what you see that day is going to depend on where you're at.
Super interesting.
And now we have a COVID pod. So one of our areas was, before it was kind of just like another medical area, but now it's been dedicated. It's quarantined. Essentially, you have to wear full PPE when you're in there, and you're seeing. It's essentially just seeing respiratory cases. So people that come in with respiratory complaints, that have fevers, and we're trying to keep them away from the rest of the emergency department patients.
So are you dealing with a lot of like COVID cases?
Excuse me. The hospital itself, you mean?
The hospital.
Me personally. Yeah, I have, now that I graduated, it just started, all this COVID stuff started, kind of March-ish, right? March, April, and I graduated in June. So I had a couple months where we were kind of just figuring out how to handle this whole situation. And then by the time, probably about a month or two before I graduated, this COVID pod kind of came to fruition. So I only worked in there maybe half dozen times. And on any one shift would see maybe 12 patients, maybe half of those would have COVID. And I think that since that time, it's definitely vamped up. So we're seeing a lot more COVID now, as you can kind of tell based on our, just what you mentioned today, that we are obviously getting worse. But I haven't been back in there. Now being a fellow, I work in a different area of the hospital. So, but the hospital certainly is getting full. I think they're still managing okay. The ICUs, at least yesterday, had some available beds. So we're not swamped. We're not overwhelmed yet, like places like New York were, or some of the other countries. But the city as a whole is probably not doing great from a COVID perspective, but the healthcare system seems to be bulging, but still managing.
Yeah, and I mean, managing is, kind of a good thing during a pandemic and unexpected crazy thing like this.
Oh yeah.
You keep saying
it's crazy, man.
Yeah.
Go ahead.
Keep saying fellow?
Yeah, so I probably didn't tell you this. I am because I came down from Canada, and Canadian programs are 5 years. Like the emergency department, the emergency specialty training is 5 years. There's 2 different paths, but for just to keep it simple, it's a 5-year training program. Okay. So coming down to the States actually has 2 different paths. They have a 3-year or a 4-year. The one that I did at Los Angeles County, USC, where I'm currently at, is a 4-year program. So I just graduated after 4 years of emergency medicine residency. And then I have to do an additional year in order to be eligible to return home. I have to get that 5th year in order to be eligible to return home to work in Canada, basically. So I'm doing that. I'm doing that 5th year now. But it's good. I mean, I would have had to do 5 years if I stayed home. It's a much less labor-intensive year. I had much less clinical responsibilities than I did as a resident. I'm just spending less time in the hospital as a whole, so my overall wellness is going up. And I'm doing a subspecialty. My fellowship is formally in ultrasound, point of care emergency medicine ultrasound. So I'm learning a new skill, or at least building on what I learned in residencies that I'll be able to use going forward in my career.
Cool, man.
Yeah.
I remember like talking to you at different points. I guess people don't know, but like me and Barro grew up together. Started junior high together. Before that, we ran like track and field against each other, like a little bit.
Yeah, we did.
Hard to remember, but yeah. And yeah, I guess we would talk at like different points. And I guess I'm kind of interested because I think at one point you were looking at like possibly doing like joining the military. And then another time you were talking about neuroscience. So I'm kind of just curious to like which field you chose and like why you kind of steered that way.
Yeah, for sure. I'm so impressed that you remember all that.
Oh, I remember our conversations, buddy.
Oh, that's incredible.
Hello? Oh no. We got a frozen doctor. So yeah, I guess I was just just curious to the whole exploring different fields of being a medical professional. And
yeah, so I guess you mentioned the neuroscience thing. The theme of kind of how I ended up in medicine is going to be a lot of just opportunity and people around me that almost shaped me and kind of directed me this way. And that was certainly one of them. I was interested in medicine at some point early on, would have been when I was at Santa Fe in university. And my aunt, she worked with neurosurgeons. I believe at the time she was helping to develop some of the equipment that they used. Anyway, she worked for actually world-renowned neuroscientist, neurosurgeon, Dr. Mendez. So I was fortunate enough to be able to work with him in his lab in the summers, doing stem cell research with Parkinson's disease. So that kind of got me introduced to medicine early on. I definitely learned pretty quickly that I had very little interest in being a surgeon and didn't really want to do much neuroscience research going forward. But I did spend 3 summers with him there. It was a great job. And he was a great mentor to me. And then I think you mentioned the military experience as well that I was pursuing at one point. Yeah. That when I eventually got into medical school, the military offers, I'm not exactly sure what it is, but it's, you kind of join the military and they pay for the education, but you owe them 5 years of service, at least in Canada. I'm not sure how it is in the States. So I looked at that as two opportunities. One, obviously the financial burden that I would not have because the military would pay for that would be amazing. And 2, just the experience of working in the military and whatever opportunities they provided, such as travel and unique medicine that is that the military offers, like combat medicine. But it didn't work out, and honestly, for the best. I'm quite fortunate that it didn't, because otherwise I would not have made it down here to Los Angeles. The military, I wouldn't say forces you to, but you have to do family medicine through that path. which is something that I was interested in and wouldn't have minded doing, I don't think. And you can still become an emergency doctor through that path. But I'm happy where I'm at.
Hmm. Makes a lot of sense.
Mhm.
You mentioned combat medicine. Is that like different types of medicine, I guess they use for?
It's just the trauma medicine, right? So when people's legs get blown off, or the penetrating wounds, which we do see a lot of here at Los Angeles County. So I'm actually still getting trained in that to some degree. Actually, at Los Angeles County Hospital, the Navy does have a training program there. So we do have Navy doctors that spend time in our resuscitation bay with us.
Pretty cool.
Yeah, it's basically like a little war down here in Los Angeles, Kyle.
Battle of Los Angeles.
Yeah.
As far as like living in Nova Scotia and then going to LA, did you notice like a difference? Well, there's obviously a difference between like the American and the Canadian health system, but what are some of the kind of the, I guess, pros and cons that you see of each of those different systems?
Yeah, I mean, definitely different. I was trying to think of this, and being out of the Canadian system so long, I kind of do forget part
How
of
long
it.
has it
And I
been
was only a
since you've
medical
been on
student.
it?
I've been here for 4 years now.
4 years.
Yeah, so I've been immersed in this. Any healthcare system is basically going to compromise one of these four pillars for another, and the four pillars being: one, the cost of it; the second, the accessibility or access the population has to it; the next being the availability of the resources. So like, do you have a lot of OR space, or a lot of doctors, a lot of nurses, that kind of thing? And then the fourth, the quality of the service that you're getting. Here in the States, at the detriment to the universality, right? So not everybody gets this. That makes sense. So in Canada, we as Canadians identify pretty strongly with our universal health care. Everybody has access, well, at least on a theoretical basis, we should all have the same access to healthcare as the prime minister, for example, right? But that comes at the detriment of the availability of some of the resources. So if you need a hip replaced, you probably are going to have to wait for a long time to get that hip replaced because there's a line, as one example. So which healthcare system is better is a pretty difficult thing to say. I guess it's going to depend on what your values are. Me, I value the universality of a healthcare system. So I personally think that the Canadian one is better. But there are merits to both. There's pros and cons to both, and it kind of just depends on your values.
Yeah, I can totally relate. Just like there's been, I mean, I've been dealing with different injuries that I had to get like MRIs, CAT scans, X-rays,
Right.
go see a surgeon, wait another year, go see another surgeon.
Right.
And it ends up taking like 7+ years, and I'm still
Yeah,
waiting.
I believe it.
And definitely some of the times I wish, I could just pay out of pocket and go see someone. Like different points in my life, I'd probably want one or the other, I guess.
Yeah, definitely. Yeah, I mean, every day we see patients that come in that they have diabetes and they don't even have a primary doctor to give them their insulin, kind of thing, because they just don't have access to a primary care doctor. So a lot of what I'm doing in the day is trying to just direct people to how they can get access to the healthcare system.
Yeah. Do you ever find it like frustrating?
Oh yeah, big time. It's frustrating on probably two fronts. Obviously, it's frustrating on just the fact that that these patients don't have access to healthcare, and you're frustrated for them. But I'm also frustrated myself because as an emergency doctor, it's really not my role.
Yeah.
When we're really busy and we're trying to deal with really sick patients, and somebody comes in for a very minor complaint, there's definitely some level of frustration with just like having to deal with that. It's like, this is not my job. It is my job now, but that does kind of run through your mind on those busy days when, the person next to you and the room over is dying, and the person that you're dealing with has maybe nothing wrong with them. But I shouldn't say that, because everybody is there for a reason. So you kind of have to be able to understand that. And that's a very difficult part of the job. And the people that the emergency doctors that get really good at that are some of the best, because they treat everybody the exact same, and everybody leaves their booths feeling like they got really good care, even if you did nothing but just sit down and have a good conversation with them, and sometimes that's all you need.
Totally. That's something I personally feel frustrated about. Actually, I started seeing a naturopath like pretty recently ago.
Yeah.
And just like the difference from, I like my medical doctor too, but it's like I go in there and it's very quick. Like we're in and we're out. It's one thing you're
Right.
supposed to talk about. And then I went to my naturopath and I sat down for an hour and just like went through health history, all these things. And talking is like a type of medicine, right? Like being heard about your illnesses and injuries. Like,
absolutely. There's no question that plays a huge role in anyone's, disease or illness profile. I'm not sure the words to use it, but yeah. Good conversation, Kyle. Just like we're having right now. It's therapeutic.
I'm feeling the medicine right now, buddy. Have you seen, like, what's like the strangest thing you've seen since being there?
I have such a hard time with this question. People ask me it all the time. And for some reason, I just don't keep these stories filed away and easily accessible in my brain. I feel like they'll just like pop up. Something will remind me of a story, and I'll be like, oh yeah, that happened. And I'll tell it. But for me to try to recall it, I don't have it. I mean, there is so many, the personalities that come through the door at LA County is it's amazing. You'd honestly probably just sit there and laugh all day at the craziness that's taking place. There's what's called, the gallows humor, which is this, doctors and nurses kind of laughing at these sad situations around you. But let me think about it as our story and our discussion carries on, and maybe I'll be able to come up with a good one for you.
So, I mean, you spend a lot of your days obviously at Emerge and stuff. What do you do for fun? What do you do when you're outside the office?
Yeah, I've started to pick up a few, or at least trying to focus on a few hobbies now that I got so much more free time. Residency's over. I'm not just living in the hospital anymore.
Yeah.
Do you remember Justin Tracy?
Yep.
Recco? He lives just down the street. It's a small world.
Really?
Yeah.
That's hilarious.
Yeah, and he actually helped get my wife Laura a job here, which has been fantastic. So she's integrated nicely. But yeah, just for listeners, Justin, me and Kyle both grew up with Justin. I actually worked with him at Jameson's back in Nova Scotia. And then randomly, he lives 2-minute drive down the street here in Los Angeles.
That is so funny.
So, yeah, I know. Excuse me. So we started golfing quite a bit together. Try to get out once or twice a week, which has been nice. Also frustrating because golf is so difficult. And then Laura got me a miter saw last year for Christmas. So I've been trying to build some things. Built a picnic table, kitchen table. I'm gonna do a nice little wine rack for her for our room.
Unreal.
So that keeps me busy, just doing a little bit of woodwork, trying to channel my inner father, who's a construction worker.
So when we get some land, are you gonna come down and build us some shit?
Oh yeah, for a fee.
Gonna have to see your skills.
Yeah.
Alex Rumbo, his brother.
Yeah. Yeah.
He just picked up woodworking like probably a couple years ago,
Yeah.
and he's been making some like really nice stuff. He owns a business called Guns and Sons,
Okay.
and he makes like charcuterie boards and like huge wooden cutting
Oh,
boards. They're like really
that's
nice.
yeah, that's incredible.
Dude,
Yeah,
I kind of want
I'm
to,
not quite there yet, but
yeah. Well, that's cool. Picnic table and stuff. Like, it's so fun working with wood, eh?
it is. I mean, it passes the time. Nice afternoon, throw on some music, have a beer, build something, and it feels like it's time well spent because you have something when you're done. You
Yeah.
built something, and especially when you like we moved into this house, and we needed to furnish it, so everybody can use it. I don't know if you remember the bar that I was sitting next to out back. We built that.
Mm,
We'll have like gatherings, and it's just I really like that. I like seeing the stuff be put to good use,
totally.
and it saves a lot of money too.
That's actually the exact same thing. Aaron, he's the guy who's building like the eco village.
Yeah.
And we were up there the other weekend and just kind of helped him like build the deck. And that's kind of what he said, like, because he's got so many projects on the go, right? He's got
Yeah.
a aircrete dome, he's got a yurt. He turned 2 buses into like small homes.
Oh wow, amazing.
It's a really cool place. I'd love to
I
take you there
love
sometime.
this. Yeah, definitely.
And
Definitely.
yeah, he's like, man, he's like, I work on so many of these projects and just like nothing, like you don't see anything at the end of them with a lot of them. But when you're working with wood and you're like building a deck or building this
Yeah.
yurt and stuff, it's
Right.
like to see the end product is so
Yeah.
satisfying.
Yeah, for sure. Yeah, absolutely. I agree.
It's
My dad just built a sauna at the house.
unreal.
Yeah, in Mount Uniac. So I'm excited to try that out. But
Do you
that's a
guys
big
still have
project.
that cottage?
Yeah, mom and dad live there now.
That is where they live. Okay.
Yeah, yeah. So we'll be. That's close. Maybe an hour to Annapolis, but
Yeah.
it's all up that way.
Such a nice place, man.
Yeah, yeah, yeah. All those places up there. A lot of lakes too.
Yeah. Ideally, it's funny because I have this image of like what I want to happen, and I obviously know like I have to let go of some of that. Like I would love to live like near a waterfall and just have like nice
Yeah,
hiking trails.
yeah,
But the idea of just like buying land and having wood and being able to shape that into like tools and things you can use
yeah,
sounds pretty fun.
yeah, yeah. Definitely looking forward to returning home. It's going to be a fun year here. We're trying to take advantage of. It's a little unfortunate that the city's still relatively closed because of COVID, but it allows us to kind of focus on staying outside and camping and enjoying the outdoors and doing all that stuff that I know you would enjoy as well.
Totally. So you're definitely coming home after a year?
Yep, yep. We'll be home. We'll be home this time next year, I suspect.
Awesome, man. Glad to hear it.
We just got a new hybrid. We're gonna drive across the states on the way home next year and make a little trip of it.
Beautiful.
Yeah.
Are you like planning the trip out or are you just gonna wing it or what?
I'm sure we'll do some planning. I don't know if I got the cojones to just straight wing it, and Laura would probably kill me if I said we're just gonna try to drive until we find a place to camp on the side of the road. But no planning has taken place yet.
Mm, cool, man.
Yeah, not like that trip I took back in 2010 where we were just ripping around.
Oh, I remember you going on lots of different adventures.
Yeah,
Barcelona was pretty sweet.
that was a great one. I was thinking about that one the other day.
Yeah?
We had some fun.
Hells yes.
When was the last time you were in Peru?
In
Or went on
Peru?
one of your trips? Yeah.
Last time I was in Peru was 2016, I think.
Oh wow, long time ago.
Time flies.
Man, does it ever?
But yeah, and it's kind of like a love-hate relationship because I'd love to go back and visit that family and stuff,
Hmm.
but I've had so many friends and just people I know that have stayed in like the Amazon and then have gotten parasites or have gotten some weird disease or just have been like sick since.
Yeah,
There's a lot going on there.
yeah, I can imagine.
And it's like, it's so stunning. It's like so beautiful that like part of me wants to do it anyway. But at the same time, it's like just dealing with Lyme disease. And it's like, do I
Right,
really want to put myself through one of these things again?
right. You've been dealing with Lyme disease now for how long? Chronic Lyme.
Yeah, it's been like a year and 2 months ish.
Okay. Where did you contract that? Do you know?
Probably my backyard.
Oh wow.
I literally pulled a tick off my cat's face this morning that was
Wow.
the Lyme carrying, it's like the black-legged tick.
Right.
So, and just like they're just here now.
Yeah.
There's a lot of ticks here.
Yeah. Gotcha. Gotcha. Are you taking medication for it, or
Not
did you
currently.
get your? Yeah.
And like I feel like really good now.
Yeah.
This is like the longest stretch I've had of like feeling pretty healthy.
Good.
Yeah, like I feel pretty good and don't want to get too ahead of myself just because I've done that every other time.
Right.
And pretty much like the cycle for me has been like I'm healthy and then I go like for a massive run and then just boom, 2 months sick
Double
again.
wiped. Yeah.
Yeah.
God.
But I feel pretty good about it right now. And
That's good.
I don't think like just the research I've done, I know a lot of other people have had it like so much worse than me. Like definitely
Yeah.
makes me like feel for other people because there's people that have had this for like 20 plus years and just never knew what
Yeah.
they had.
Yeah. Definitely a large spectrum of disease and a kind of a subtle, difficult to diagnose one.
Yeah. Yeah. Super weird for that.
Yeah.
Is I know it like originating in Connecticut. Do you guys, I don't know if Lyme's in LA or not.
It's certainly not here to the same degree as it is in the Northeast.
Hmm.
I mean, we're such an internet, like, it's such a huge area that people are always traveling and coming back. So it's something that we keep a lookout for, but not overly common. A little bit more north, like Northern California would have a little bit more than the Southern California.
Hmm. You're in the good spot then.
Yeah.
Keep away, buddy. Dude, Annapolis is somewhere you definitely have to know about that too.
Yeah.
I had 4 on me the other weekend.
Oh my God.
Like, it's like terrifying.
Tons of ticks. Yeah, we always try to keep Charlie, our dog, medicated because she's always running around in the woods when we take her.
So you give her like antibiotics or something?
No, just the kind of prophylactic anti-tick
Hmm.
medication. Yeah.
Hmm.
Yeah, it's the medication is to prevent the tick, not the bacteria, not the Lyme.
Hmm.
Yeah.
Interesting.
Yeah.
Gotta get me some of that, buddy.
Yeah. Dose you and our dogs tick meds.
I'll do what I gotta do at this point. No, like I took antibiotics for 3 weeks to a month.
Yeah.
And then I took something called Lyme Kill, which is like what my naturopath recommended, but it's kind of like the natural version of antibiotics that's like specific for Lyme.
Okay. Interesting.
It's real. Are you familiar with like the Herx reaction?
Yeah.
Fucking weird. It's the first time I've ever experienced anything like that in my life.
Yeah. As the bacteria were getting killed.
Yeah, just I think that's what confuses a lot of people that have this because
Yeah.
you feel way sicker when you're
Yeah.
getting better.
Yeah.
So then they stop taking it because they feel worse on it.
You're right.
But you have to go through this just terrible period of feeling like complete and utter shit.
Yeah. Yeah.
Super confusing.
Yeah, it can be. Yeah, we see in the emergency department with things like other infections such as syphilis or even a kidney infection. When we give them the antibiotics, it pretty quickly lyses the bacteria and makes them
Mm,
Makes them sicker in the short term.
yeah. Well, buddy, I should probably let you get to work.
Sounds good, man. Thanks for calling. This was great. We should do it again.
Oh, dude, I appreciate you coming on so much. And yeah, for sure. Happy to hear that you're going to be back home and we'll go do some woods exploring. Tick free,
I
though.
am looking forward to it.
Sweet, man.
All right, buddy.
All
We'll
right.
talk
Peace.
to you. Stay in
Peace
touch.
out.